So beginning with your inspection here, I did see that you were interested in just having an overall visual inspection completed, ensuring that there is nothing concerning going on. Now, I did have the nurse practitioner do a brief overall examination to see if she noted anything, and she did say there was just a couple things that maybe could be looked into further. So I'm just going to do a follow-up and see if I agree with her findings, if there's anything I think needs to be assessed specifically. Now, one of the things she noted was that there was some discoloration of the scalp, particularly like pinkhead or paleness, so that's something I will look at. She did also mention that you had a little bit of a dry scalp, which I am noting here. I do see a little bit of dandruff, so I will have a look at that and see if there's anything I think that's causing that could be more serious. I know you have a history of eczema, but not on your scalp, so it's something that I think we can stand to have a look at further. Now, she said that your biggest concern was tension headaches, and that's not something that you really have a history of, so I do want to look at that and see if I think there's anything specific that could be causing that. So it looks like I do see a couple moles here that she mentioned, so I will have a look at those. It appears as if you had some holistic therapy done, so you've had acupressure done at some point. So I'm just gonna have an overall look here first of all. To see some slight misalignment of the shoulders. Scapula here is slightly higher. Let me just have a look at that quickly. So yeah, we are slightly misaligned, whereas the midline would have you off center on the right side. So do well by referring you to a chiropractor. So chiropractor is a specialist who can do a realignment of your spine as well as your other joints. See, I'm seeing a difference here. Now, I didn't see any notation that you had any previous injuries to your spine or to your back or shoulders, so what I would guess is that this is the typical, what we're calling COVID spine. So essentially seeing an uptick in cases of my patients who work from home, particularly those who have worked from home since the start of the pandemic. With the sitting, especially if you're not using an ergonomic chair, there can be a misalignment of the spine, and to me that is what this appears to be. I do often see that coincides with tension headaches, so the good news is that I don't think it's anything related specifically to the spine itself. We're not looking at any spinal fusion, spina bifida, scoliosis, anything that is more nefarious that would require a specialist. So I don't see it necessary to refer you to an orthopedist at this time. I would, however, like to see you visit a chiropractor. So I do see some slight extension of the thoracic spine there. Okay. going to do some percussing of your neck here. Feeling for anything beneath the surface of the skin that feels particularly concerning. And I'm also feeling for any areas of edema or pockets of fluid, as well as listening for any audible differences here. So just listening for any notable areas of concern. So I'm going to do that along the spine itself. So you let me know if any of this causes you any pain. So I do feel one area of distension at the vertebrae here. It's about L5. So the top of your thoracic spine, or the top of your spine, which is kind of at the base of your neck here, I am feeling an area of distension. So typically that means when you're sitting at your computer chair or at your desk, you maybe are kind of hunched over, you're hunched at the neck, and that leads to distension here where you start to see a lumping or like a roll at the top of the spine. And you are in the very beginning stages here, so it is something I think we can mitigate with proper therapy, but I do want you to be conscious of it. Try to be more cognizant of your posture while you're sitting. So I'm just feeling to see how severe that is. So I would say this is about a stage 1. I do think, however, if this goes untreated or if you continue to use improper posture, this is something that could get worse. So I would recommend upgrading your chair at home if possible. It is also possible that your job would consider providing that, given a note from your provider. So that is something that I would be willing to do for you. I could write you a note essentially saying that this is a medical necessity, and because you work from home, your job would be responsible for providing you with that equipment. So you let me know what you're comfortable with. So I'm just going to feel along this area and see if I feel anything else in the nearby skeletal structure that is concerning as well. So I'm just essentially ruling out any further injury. I do see just a little bit of fluid buildup here between the scapula, which is normal, especially if you've been stressed. We tend to hold a lot of tension between our shoulders. That doesn't feel too bad. I do want to assess these moles though. So I'm going to have a look and see. So I see one freckle here. This one doesn't look particularly concerning. It is normal in color. It is not raised above the surface of the skin. And the margins are fairly symmetrical and circular in shape, so that one is okay. Another one here that is about the same. Margins are circular and it is not raised above the surface of the skin. Now this one obviously is quite raised, and the color I would say is mildly concerning only because there are just a few darker spots within, specifically here. Now, the shape is round, very circular, even, symmetrically. I think I would classify this as something that we would want to keep an eye on, so I'm not going to say just yet that this needs to be removed, but it does need to be documented adequately so that we can assess it in your future visits. Now this one here is actually concerning to me. Switch over to the brighter light here. This one here is concerning. So it's not circular in shape, it's kind of oblong, and one side is slightly more rigid where the edges are uneven. There's also more discoloration here, whereas it's kind of graded in color and gets darker towards the bottom, so that is slightly concerning. It's not extremely elevated above the skin. I do feel a slight raising there. I would like you to have this one assessed by a dermatologist. Obviously, you're probably not aware of whether or not it's changed in the last few years, as it's on your back and rather hard to assess. So I am going to go ahead and notate both of these, and I would like you to see a dermatologist and have them assessed more thoroughly. They can take a sample specifically of this one and test for things like melanoma. Make sure that it is not cancerous. If a dermatologist does think this one is concerning, they might want to go ahead and remove it, just precautionary, and make sure that it doesn't end up developing into anything more malignant. So, okay. So that answers that as far as the moles are concerned. Now, I see one more small one here. This looks okay. This looks more like a freckle than anything else. So again, it is flat. And the color is even, very symmetrical. Not concerned there. Okay. Look at your scalp a little bit further. The nurse practitioner did say that the areas that appeared abnormal were kind of sporadic. So I'm just going to separate a couple different areas here and have a look. Now, I know you said specifically you do not have a history of dandruff, but you do have a history of eczema. And we are coming up on the colder months, so it does tend to become slightly exacerbated as the weather changes. Now, we have seen changes in my patient's skin even well into adulthood, so some people tend to think, well, I'm in my 20s or I'm in my 30s, what are the chances that I'm just now developing dandruff? But it is possible. Especially if you've moved to a new area, seasonal changes, geographical changes, all of that does make quite a significant difference in our skin. So, dandruff, of course, is not very concerning. It is fairly common and can be treated with over-the-counter medication, topical solutions, dandruff shampoos. In severe cases, we might prescribe you something a little bit stronger, such as ketoconazole, which would be in the form of a medicated shampoo. There's also creams that you would apply, or ointments, I should say, that you would apply a couple times a day. So I'm just gonna have a look. Now, I do see that your hair is color treated, and the reason I mention that is because I have seen patients develop an allergy to artificial hair color. And that is something you can develop at any age, any stage of life, and regardless of whether or not you've used artificial color in the past. So I do have some patients who think, well, you know, I've been dyeing my hair for years, I've been getting my hair done for years with the same stylist or whatever the case is, and then they suddenly develop an allergy to the hair dye, and it's just something that happens. Unfortunately, our bodies are ever changing, and we just kind of have to listen to the symptoms and be open-minded to any changes that might develop. So I am seeing most of the affected area tends to be kind of mid-scalp, and then specifically towards either the nape of the neck or the crown, or along the hairline. So this to me does just look like typical dandruff. I'm not seeing anything that I think is particularly concerning. It also doesn't look like eczema to me, so I would not say that your eczema has migrated to your scalp. I do think this is just regular dandruff. I do see a slight abnormality here. Okay, so it does appear as if you just have a slight elevation in texture in this one area. I was able to dislodge what appears to be a patch of dry skin that was surrounding a slight ingrowth. So your scalp as a whole does appear just slightly dry at the follicle. There are products you can use that you can buy at your local drugstore, grocery store, Target, that kind of thing, that are specifically geared towards exfoliation of the scalp. So I would consider picking up something specifically formulated for the scalp. I don't want you, using a body scrub or anything like that. You do want to get a scalp scrub itself, either that or you can use castor oil, just plain castor oil with like a scalp scrub brush that you would use while shampooing. Just apply the castor oil all over the scalp, ensure that it's penetrated completely down to the follicle in each area. This is easier typically if you section your hair and do it section by section, and then you use the shampoo brush to essentially exfoliate the scalp itself, and that'll help dislodge some of these more impacted follicles, because I am seeing a buildup, one of product but two of dead skin cells, so it's definitely something I recommend looking into. So the good news is I'm not seeing anything that looks super concerning, other than the referral to the dermatologist. Now, before concluding your examination, I do just want to do a brief test here to make sure that there's no chance that this could be a neurological deficit. So what I'm going to do is apply a couple different stimuli to your head, as well as your neck and back, just quickly to test for your sensory perception. Occasionally I will see that this test is abnormal. It's not very frequent, but I do just want to make sure before you leave here today that I'm not missing anything. I would hate for you to have to come back if there's something that I could have diagnosed while you were here. So I'm just going to test this briefly in a couple different areas. So I'm going to start with this tool here, and I do apologize, it is cold and rather ticklish. I'm going to look to see for any abnormal reactivity. So I'm just going to glide this along the scalp. Good. So I saw a normal reaction of the spine there, which indicates that there is proper neurological functioning. So same thing, I'm just going to test that here. Slightly less reactive there, but I did see movement. Very good response there. So I'm just going to test that quickly along the neck horizontally, and I do see good movement here as well. Very good response. So just going. Very good. So your sharp response is definitely intact. And just going to test for soft sensation. So very gently grazing here. Again, seeing healthy movement. And down along the spine, once again, very healthy movement there. And testing bilateral response here, so that should feel the same. Very good. Very good. Okay. Okay. So certainly not concerned that this is anything neurological. Now, the very last thing I'm going to do is just have a listen with my stethoscope. So I'm just going to listen for any occlusions, any sign that there's not adequate blood flow to the base of the skull. So that sounds good. I am hearing adequate perfusion. Certainly not hearing any sense of occlusion here. Okay, so all of that sounds really good. I didn't hear anything internally that I thought was concerning. So that's a good sign. So what I would like to do is get you a referral to a dermatologist. Now we do have one in-house. You are welcome to come see her. I can put all of that information in your patient portal for you. Of course, if you have a personal dermatologist that you would rather see, that is totally fine. I would like you to let me know either way so I can send over the proper documentation so that all of your providers can be on the same page. So I am going to notate in your portal. I would like you to go ahead and look at that within the next couple of days, and then you can just let me know via your portal either way whether you're wanting to see our dermatologist or your own personal, and then we can proceed with care from there. And of course there will be notes about all of our abnormal findings today. Okay, so of course your dermatologist might prescribe you something more specialized, but at this point I would say you are good to go ahead and order just a regular bottle of Head and Shoulders. You can pick one up at the drugstore or order it online. I do often recommend the clinical strength, which is the blue bottle, versus what's in the white bottle, just because it tends to work a little better. So you want to use that at least twice a week. I do recommend shampooing your hair twice with each wash, and I would say within a week or two you should start to see a bit of a difference there. Now, as far as the moles are concerned, they will have to do a workup here, take some measurements, take some pictures, and then they'll have a more extensive look at that. Okay. All right. Well, I am going to go ahead and head to my office and take a couple of notes. Just be sure to look at that for me so that we can get you sent over with that referral. Okay? All right, Isabel, I appreciate you for coming in. I'm glad we were able to have a look at things, and I certainly hope that you get to feeling better.